Hi everybody, we're here at Arco on Trainers Trainer Day, so it's a good opportunity for our trainers from all around the country to come in and do a bit of CPD, learn on the latest things. We've also got some suppliers in, so this is Brad from Mia who do first aid supplies. So what have you got here, Brad?
Awesome. So yeah, I'm Brad, I'm from Mia, and we do trauma kits. So there's a range of kits that you can see maybe just behind me there. And we've also got here, which is our W1 response bag. And with this response bag, you can see here, it's quite nicely labeled who this is for. This is for the medic, and we can change those and customize them to the specific operation that you might be on. You can see here also there's catastrophic hemorrhage and airway, and with that we have the what we have dubbed the NHS 10-second triage pull down quick access panel. And essentially what that is you've got your airways here, as it says, and you've also got your catastrophic hemorrhage equipment, and we've put here a pelvic splint as well. So if you go to a major incident and there's multiple casualties around, what you want to do is treat them, obviously, but what you want to make sure is that you're not spending all your time on one patient. You've got a mass triage, so you've got some airway stuff in here, and basically if they need more than what's in here, you move on. So you flap that up and on you go.
Yeah, so you quickly run around, treat everybody, get them triaged.
Absolutely. Yeah. And then hopefully, you've got more help on the way and things. But that's that sort of quick access panel that we've created here. But you can customize it. You didn't have to follow what we've got here. If you wanted to change this, you can. It's Velcro, you just remove it. But also these are elasticated, so you can chop and change to fit your own individual needs, as well as the panel here. Once you've got a little bit more time to stay and play, you have what is here further into the bag. And as you can see, it is extremely colourful. And the reason for that is we've colour-coded everything to so that it's easy to go and treat a patient. And I'll explain why in a moment's time. So we'll start with catastrophic hemorrhage again. So this is just more in-depth equipment in here. You've got then airway, breathing, circulation, medication, hypothermia, diagnostics, and minor injuries. So we've done it in a way in which you start here before down here for minor injuries. And so you're inadvertently treating the patient in the way in which you've been trained to treat the patient without even thinking about it. So you're reducing that cognitive load, in which case you could treat the patient quicker. If I'm over here and treating a patient and you're not medically trained, I can also say to you, pass me the laryngoscope. And you might look at me like I've just spoken a completely foreign language. But hopefully, you'll know what that is. But if you don't, I can say, pass me the green pouch. And, if you're colorblind or you can't see that, hopefully you can read that, pass me the airway pouch. And these just Velcro out. So you can just remove these and pass them down to the person treating the patient. That'll work really well in confined space as well, because obviously it's a small pouch, so you're not going to be able to take the whole bag in, granted. But what you can do is you can pass that down and just pass it to whoever, as and when. Just while we're here, you can see that there is some straps here, and that's for an O2 cylinder. So this bag will fit a full CD O2 cylinder in there. So you can chop and change and move things around. But this is how it comes as a standard loadout. So that's the W1 response bag. And what we'll do is we'll turn it round. So here you'll see it is actually a lift-rated bag. So if you are working at heights, you can winch it. That's not a problem. It has been tested and it is certified for that. It's also made from durable PVC fabric. So yeah, that's the W1 response bag. Let me know what you think.
Yeah, it looks quite robust. And you were saying earlier that you only sell these bags based on what the person's certified for. So if you're FREC 3 trained, you'd only get FREC 3 if you're a paramedic.
Yeah, absolutely. Yeah, so that's one of the points actually we just didn't touch on just then. But essentially, we kit it out to what your scope of practice is. So if you're a paramedic, you'll have cannulas in there, maybe some other more advanced bits of equipment. For FREC 3 medics, obviously they can't do that skill. And so what we don't want to do is just sell a load of kit to you that you're never going to use. But also, it becomes a compliance issue if you've got medics running around with equipment that they're not trained to use, because I'm sure one day they will decide to use it.
So obviously this bag's quite big and not everyone's going to be FREC 3 trained.
Yes.
So what other options have you got for smaller bags?
So we'll just have a look over here. We have got some of our smaller bags here. So you can see this is our FREC 3 response kit. So it's slightly different, slightly smaller, as you can see. And this is designed to, when we get in there. So first of all, nothing's going to fall out. That's the first thing you'll find with this bag. So you've got catastrophic hemorrhage on one side, airways, and then more. There's more bits of kit behind there, but it's for a FREC 3 trained medic. We've decided, and there's a little pouch here that's got some minor injuries bits in. Essentially, we've decided to not kit, unlike every other kit out there. If it says first aid kit, you think millions of plasters, 120-piece first aid kit, 200-piece first aid kit. Ours aren't like that. Ours are designed to stop a bleed, help someone secure an airway, so help them breathe, and then minor injuries are just a sort of bit on the side. You know, I myself quite outdoorsy, do a lot outdoors, and you know, if I cut my finger, I just wipe it on my trousers and carry on with the fun of the day. But if I had a normal first aid kit and something severe happened, I might not have the equipment in there to be able to deal with that. So we've kind of reversed engineered it and put in the life-saving kit.
So what's in there as a FREC 3 kit that isn't in your normal first aid?
Yeah, so a normal first aid kit tends to just be, you know, foil blanket, loads of variety of bandages, triangular bandages, and so on. This kit has all of that, but it also has the catastrophic hemorrhage equipment. So on part of your FREC 3 syllabus is to go over bleeds. It's also to go over airways as well. So it's got that added bits.
So OP airways,
yes,
cat bleed stuff.
yeah.
Celox.
Celox is in there. So you see you've got your Celox Rapid, UK manufactured hemostat. It's the best one that's out there. It's got the most evidence behind it. There's bags and bags of information about it. You've got a trauma bandage in here. As I say, it's just that little bit more comprehensive than your standard office first aid. And you know, when you're working in these sorts of environments, really you should be prepared for for the worst to happen. It's not to say office first aid kits aren't good; they have a place.
Yeah.
But also we've got to understand there's limitations, and it's not a one size fits all.
Yeah, and for us, like dragging around a massive bag, in addition to our training kit as well, we're more likely to have that to hand than a massive bag. Yeah, so that's nice.
Awesome.
Good stuff.